We don't have a quorum.
Yeah, we need two more.
Yeah, but you could start the discussion.
We don't have quorum yet, but we'll start with our opening statements. That's okay? Yeah.
We can waive. They can waive it, so they said they'll waive it. So
Sounds great. Okay, great. Today, the committee is considering multiple bipartisan pro-worker, pro-family, and pro-patient bills strengthening Americans' access to quality health care and retirement benefits. I really appreciate colleagues working on these bills. When the committee sets politics aside and work together, we can deliver real results for American families. I hope this to be the first of many markups that will move down dais member priorities from both sides. We're voting on bills to strengthen employee stock ownership plans, ESOPs, empowering workers to have a stake in their company and build wealth for themselves and their families. Senators Marshall and Kane's Retire Through Ownership Act clarifies federal law ensuring ESOPs can sell shares of their company to employees without the fear of frivolous lawsuits. My Employee Ownership Representation Act adds 2 new ESOP board members to the ERISA Advisory Council. Senator Hassan is offering an amendment to this bill, which I look forward to supporting. It improves the bill, and I appreciate her thoughtful engagement. I also want to note the committee is not voting on the Employee Ownership Fairness Act to authorize ESOPs to contribute into 401k plans without exceeding contribution limits. Every witness last week underscored how this strengthens employee ownership and puts more money in workers' pockets. Several committee members from both sides have expressed strong support for the goals of the legislation. But the bill is not on today's agenda. We're working to refine the policy. Frankly, the score was a little bit more than we thought to get it in a good place so it can appear on a markup in the future. Additionally, the committee is reauthorizing the over-the-counter monograph drug user fee amendments, a MUFA, to improve the Food and Drug Administration's review of OTC drugs so they can be more quickly available while still ensuring safety. The committee held a hearing last month on enhancing a MUFA, and I appreciate Senators Banks and Kane for leading this effort and the work of Senators Marshall, Husted, and Hassan to include additional policy riders to speed up the review of sunscreen and allow more drugs to be available OTC. Senators Murkowski and Duckworth's Uniform Services Leave Parity Act fixes leave benefits for Public Health Service Commission Corps officers. It now gives them the same leave available to other members of the uniformed services. Senators Scott and Smith's Improving Care in Rural America Reauthorization Act helps address the health care needs of rural communities by reauthorizing 3 grant programs supporting access to preventive screenings, telehealth services, and chronic disease management, important pro-patient priorities for this committee. Senators Collins and Smith's Kay Hagan Tick Reauthorization Act strengthens programs to prepare for and respond to tick-borne and other vector-borne diseases which are rapidly spreading in every state. The legislation is named in honor of former Senator Kay Hagan of North Carolina, who passed away from a rare tick-borne disease in 2019. Specifically, the bill improves coordination among federal agencies, health departments, and scientists, and builds regional capabilities to respond to vector-borne disease outbreaks. I thank Senator Collins for her steadfast leadership in this issue critical to Maine, but to us all. Thank you all for your good work. I look forward to advancing these bills as part of our pro-worker, pro-family, pro-patient agenda. And with that, I recognize Senator Sanders.